I'm putting posters up in pubs with a QR code that's so wrong. I shouldn't have to do that.
A really harrowing call to Matthew Wright at LBC from a lady who has had private healthcare for years but cannot get this healthcare company to pay out for the treatment that she needs to save her life. And it shows how far down the line Britain is going towards the American system and what it means for everyone going forward, which is families being burdened with debts or people dying because they can't afford to get healthcare. And the other catch-22 of becoming more like America is lower food standards, which have a detrimental impact on public health, ensuring more business for private healthcare. And added to that, there is the hugely alarming issue of antibiotic resistance, because the American food system allows the use of antibiotics in industrial farming. That is ensuring that bugs are becoming resistant to antibiotics, and that is an enormous issue going forward.
To you, Carol.
Good morning, Matthew.
Have you ever had to put aside money for health treatment?
Have I? I'm on £200,000 that I've had to pay out for my own cancer treatment, and I have got private. Yes, I have got private medical. I've got private medical, fully comprehensive cancer cover. The drug I need is licensed with NICE, and they won't pay out. So I've had to pay £40,000 per treatment. I paid £120,000 3.5 years ago, which has saved my life. 4 years. God. Yeah, I was almost 4 years cancer free, and it's reared its ugly head. So I've now paid in the last 7 weeks £80,000. Now, Matthew, I haven't got that kind of money.
I don't think many people have.
No, I've cashed in all my pensions early at 52. I've had all my savings have gone. My husband's just got inheritance from his late father. All of that has gone on this treatment now. I'm having to do a Carol Player GoFundMe in order to save my life. And it's like I'm playing a game of Monopoly with Monopoly money. And my private health, I'm not paying out. I won't mention them, but they're not paying out. I'm currently on my way to Southampton now to have my operation tomorrow. And what they do is chemotherapy. It gets directed. I've got ocular melanoma.
Okay.
It's spread to my liver, and they go in through the groin, they saturate the liver in chemotherapy, they drain it out. I don't even need paracetamol after. That's how effective this treatment is. I've got so much to live for. I've got a family. I've got 7-year-old grandchildren, and I'm well in myself. I'm completely well in myself. I'm fit, but I need to live, and without this treatment, I will die. And that's the reality of it. But without me fundraising, Carol Player, GoFundMe, I'm having to, this is so embarrassing because I thought years ago I will support myself and get private health. My kids will always need me. My grandchildren need me, and I protected myself against all of this. And now when it comes down to it, they're leaving me to die, and I can't allow that to happen.
I mean, we've been talking a lot of late. I'm so sorry. I find these very difficult just to hear the situation you're in.
I'm desperate. I am desperate.
I can tell.
I'm begging. I've never begged for anything in my life. I've always made sure that I've worked hard. I've paid my taxes. I've supported myself with private medical. And I'm feeling
Can I ask, why are they not paying out? If you've got insurance for cancer and you have cancer, I mean, I'm obviously oversimplifying, but surely that's...
Well, 3.5 years ago, it was on a trial. The NHS were trialling it. There's people walking around that's had that trial that shouldn't be walking around today. We're all touched by cancer, all of us are. but people that shouldn't have been walking around, they were given 6 months to live and they're still here. This treatment is so effective. So it got passed by NICE. So I understood, the insurance wouldn't pay out at the beginning, but now it's passed. 2 years ago it's been passed with special measures, and the special measures is we have the right team of doctors to perform that operation, and I've got the right team of doctors. People are flying in from all over the world to Southampton to have this treatment done, and, I know there's 17 people this month on the list to be done, so it is effective. But it's wrong. They're saying now it needs to be used widely in the UK. Well, how can a rare cancer that you've got a treatment for a rare cancer, how can that be used widely in the UK when it's so rare? It's small print. It's just small print.
I'm trying to think of something I can offer you by way of comfort, Carol. I have nothing.
What I would say, Matthew, if at all possible, is get my story out there for people. And I shouldn't have to do this, and it's embarrassing. But I am doing a GoFundMe.
Well, but why didn't you give us? A lot of people are asking. A chap called Mark straight away asked, "What's the GoFundMe address? Clear and slow, please." Is what Mark's asking. So let's have that GoFundMe, please, Carol.
Yeah, it's Carol Player GoFundMe,
and that's Carol with no E, isn't it? C-A.
Yes, yeah. Carol with no E. Carol, C-A-R-O-L, and then football player, P-L-A-Y-E-R. So it's Carol Player, GoFundMe, and it's called Carol's Journey.
Okay. What a crap journey as well, I have to say. I mean, that is just not. You see, I've always been under the impression, because it's the commonly trotted out line, that you can have private health insurance, but when something really bad happens, you go to the NHS. And you have got both private health treatment and an NHS, and both have failed you.
Yes, absolutely. The NHS, I've got to say, have been okay. I mean,
their hands are tied, aren't they? They can only do what they can do.
Their hands are tied, and that they've saved my life as well. So I've got to be good there. But the fact that I feel the injustice of the private health, I just think anybody getting private health should look into the policy so deeply to make sure that everything is kosher, because I'm in the situation now where I've never begged for anything in my life, and the general public have saved me. With this GoFundMe start, I've got to get it off the ground now. It's only been a few days, but I'm putting posters up in pubs with a QR code that's so wrong. I shouldn't have to do that.
Carol, you really shouldn't be having to do it.
Daisy is out here having a nice little snack before going to sleep. Not sure where the calf is. Chasing the dogs off.